Hey friends, I know it's been a minute since I've been on here. I've been super busy, but it's been a good busy. I've been in the DMV area, getting situated, doing what I need to do, getting things moving. And some of you may know that I pick up shifts through an app called ShiftKey. ShiftKey allows you to pick up apps based on where you're located. And they're usually long-term care facilities, but I do see that within the app they have the option of you doing med-surg, psych, and other specialties. I just so happened to find a facility since I arrived here that basically specializes in, I want to say rehab. Okay, maybe it's not rehab, recovery. Anyway, to give you an idea of the patient population, most of them are on something called methadone. Most of them have standing or PRN orders for pain relief. Most of them have, some kind of drug history. You can see it when you assess them, physically. You can see it when you look at their medication records and their history and their orders and all of that. And the main point of this post is, for the last couple of shifts that I've had at this facility, there have been some ODs. If I can't say that, somebody put it in the comments. But there have been some ODs. And when I speak to some of the staff, because the staff there is great. This is one of the reasons why I continue to return to this facility, because the staff is exceptional and amazing. And if it weren't for the staff, I don't even know if I would constantly just accept shifts or, answer their call when they call me in to, pick up a shift or two. So anyway, I asked them and they said, well, we haven't had any ODs recently. However, the last, I guess they said 2 years ago, it was really bad. Like almost every night that you worked, maybe, I don't know, a couple of patients, 1 to 2 patients would have an OD. And I asked, because me, I'm a very curious person. So I asked, where are they getting this, contraband from? And when I spoke with one of the security guards at the bottom, she had stated that somebody had come in as a transfer from a different facility, or just came in as a new patient. And ever since that patient came in, there's been some series of ODs, right? Now, a lot of people are unclear about what the substance of choice was, because Narcan was used and it was not effective. For one particular patient, it was used 3 times and it wasn't effective. So my question to any nurse who works with this patient population anywhere, could be, in any state, okay? What things do you all have in place to prevent patients that are coming in with contraband, okay, to prevent them from, sharing it with the other residents and then subsequently having these situations? The only reason why I ask is because, how like they search you when you go to the airport through customs, I went to school in New York City, so some high schools have like metal detectors, and they also detect other things as well, right? Why is it that some of these facilities that deal with this vulnerable patient population, where they're more likely to, use certain substances and, possibly unalive themselves by the use of these substances, why can't there be some sort of like a magnetic contraband detector, right? So basically, before you're admitted, wherever the admission entrance is at would have that contraband detector, and then basically whoever has anything on their person that could be potentially, have an unaliving effect, it would be removed from them, confiscated, destroyed. Or if they refuse to remove it from their person, then they get turned away. They don't get admission to the facility, and they have to stay wherever they're at until they're willing to abide by the rules. Is that harsh? I'm new. Like, I've worked with patients that are on methadone that have a history of substance abuse. But this was years ago. I started off at a really heavy, trauma, level 3 trauma hospital in the South Bronx. Some of y'all can guess what hospital it was, but I started off there. So there's nothing I didn't see in the beginning of my nursing career. But I'm just curious, like, how do we stop these ODs from happening? And Does this sound far-fetched, like a contraband detector, as opposed to a metal detector? Let me know your thoughts in the comments, because I really like this facility. I like the staff. Some of the patients aren't bad, but this population is a very different type of population to deal with, if you understand what I'm saying. So let me know in the comments what y'all think, but that's been my experience. It's been really sad to hear, patients just OD and then be unalived, and they just don't exist anymore because somebody decided to bring one substance into the facility that has the potential to kill, to unalive people. All right, I'll see you guys in the next one. Bye.